Hi, my name's Julie, and I'm going to tell you about Ehlers Danlos syndrome. Ehlers Danlos syndrome is an underdiagnosed, underrecognized syndrome that affects the connective tissue of the body. It affects 1 in 5 to 10,000 births, both males and females. My son and I currently suffer from this syndrome. My son has a more severe case. By the time I finish my speech, I hope you will have an understanding of Ehlers Danlos syndrome, how it progresses, and the symptoms associated with each type. Most people with EDS spend years going from doctor to doctor looking for the proper diagnosis. It is recognized as a rare disorder in the National Organization of Rare Diseases. It can be life-altering and life-threatening. What are the types of EDS? There are 6 major types, and each type has a distinct disorder that runs true in families, meaning you will not see different types in the same family. However, researchers are now finding that this may not be true. For instance, in my family, I have hypermobile type and my son has classical type. Ehlers Danlos is a group of heritable connective tissue disorders that's characterized by joint hypermobility, skin extensibility, and tissue frailty. Individuals with EDS have a defect in the connective tissue. It is usually in the collagen. The collagen is the type of glue that holds your body together, adding strength and elasticity to the connective tissue. Hypermobile type. You generally have joint hypermobility. It's the dominant clinical sign. Generally in the large joints, the elbows, the knees, the hips, sometimes in the fingers and toes. You have recurring joint subluxations and dislocations. The skin involvement, where your skin is smooth and and there's easy bruising. Chronic joint and limb pain is also common, and you can have early onset osteoarthritis. Skeletal x-rays are normal. That's why this type is so difficult to diagnose. There is also no genetic testing for this type. The classical type has more skin involvement. The skin is more elastic. You have widened scars, pseudotumors over the scars, or little bumps over the scars. The joints are hypermobile, just not as much. You can have joint dislocations and subluxations. You can also have some organ involvement as far as rectal prolapse or anal prolapse and hernias. There is clinical testing for this type. However, it doesn't always be found in the family. For instance, in my son's case, they have not yet identified his genetic defect. Vascular type is the most severe form of EDS. It is the most form with organ involvement. Generally, anywhere there's large vessels, the vessels are more elastic. You can have spontaneous rupture of any of those organs. You do have some joint involvement and some skin involvement. Generally, people with vascular type have protruding eyes, thin nose, and locked ears. There is also a genetic test for this type, and generally, if your genetic test for this type comes back negative, you do not have vascular type. Kyphoscoliosis type generally can be found at birth, and generally you have early scoliosis, severe muscle hypotonia, which is very floppy babies. There is some joint involvement. The tissues are frail, atrophic scars, easy bruising. The corneas can be involved, and there also is genetic testing for this type, and it can be tested by a urine test. Arthrochalasia type is generally babies are born with hip dislocations. They have joint hypermobility and with recurrent subluxations. They can have tissue frailty and easy bruising also. Mild osteopenia, which is the beginnings of osteoporosis, can be seen on x-rays. It is also can be typed in a genetic test. Dermatosparaxis type is mostly skin involvement, and that's mostly skin stretchiness, and the scarring can be seen. The skin is more soft and doughy, kind of like you feel dough. It can be tested also by genetic testing. The number of people with this type is very small. The gold standard for testing for joint hypermobility is called the Beighton scale, and you get 1 point for each area that they test for a total of 9 points. To test for that is the thumb can go to the forearm pretty easily. So as you can see, I have 1 point for each thumb. The little finger can bend back past 90 degrees. So I have 1 point for each finger. Your elbows go back past 90 degrees. And your knees can go back past 90 degrees. Also, the last thing is if you can bend over and touch the floor, keeping your knees straight, palms flat. So as you can see, I score a 9 out of 9 on my Beighton scale, which is very positive. Anything over 7 is positive. My son scores a 7 out of 9. So he is not as hypermobile as I am. What is the prognosis of someone with EDS? The prognosis depends on the specific type. Life expectancy can be normal in most types. In the vascular type, your life can be shortened because of spontaneous organ rupture. In the other types, your life may be shortened if you have vascular involvement, such as the aortic root dilatation or aortic aneurysm. What can you do now? Defining trait of those affected by EDS in the search for information. Internet usage has helped families identify their type and has been a significant help to families. More research needs to be done, and donations to the National Foundation can help with this endeavor. In conclusion, EDS is an underdiagnosed and underrecognized syndrome. It is important to learn the signs and symptoms and bring them to the attention of your physician. It affects every 1 in 5 to 10,000 births. I hope you have an understanding of Ehlers Danlos syndrome and the signs and symptoms of this debilitating disease. I would like to thank the national organization, Ehlers Danlos National Foundation, at www.ednf.org for this information, along with EDS Today, which is a great place for families to find information, and they have a newsletter at www.edstoday.org. Also, the National Organization of Rare Diseases at www.rarediseases.org. The Beighton scale is complements of www.arc.org out of the United Kingdom. Thank you very much for your time.